take that thing and you put it in there, and that's what you look like. And Bud Light, by the way, is not really helping. You know. So I know everyone here knows there's a direct correlation. It's not just how you look, but the direct correlation between obesity and a whole bunch of metabolic diseases, and diabetes being one of the most important ones. In fact, if you look at the continuum for both adults and kids, overweight and obese leads to insulin resistance, which a quarter of our population has, which leads to diabetes and cardiovascular. 28 million Americans have diabetes. So our Americans' current disease path, we are actually enabling our patients and our clients, and ourselves, by the way, to move from being optimally healthy when we're born to being non-sick, to being diagnosed with the disease, put into the ICD code, and then treated with a whole myriad of different things that actually drive the economic engine called sick care. The forecasted path is moving this way or to the left, and actually it's happening at an earlier page. In fact, uncoupling biological and chronological disease, we can't call it adult onset diabetes, which was a disease mostly of middle age and old age. It's now happening in kids as young as 5. I just heard yesterday a horrific story where a child of, I think it was a year or less, had gastric bypass surgery. So it's fundamental that we start taking perfectly good organs and rearranging them, especially in young kids, without, we need to change our medical structure. So this is taken from New England Journal of Medicine. This is what Australia's done. You know, they down there, they were all pirates anyway, so they don't give a crap. And they basically now, on the packages of cigarettes, they put pictures, beautiful pictures like that, like gaggers. And since I couldn't get their rights, I actually had my artist take his own foot and turn it into that visual. So that's not, just full disclosure, that's not actually foot. But I mean, isn't that amazing? And you know that's reality. Well, the same reality, if we don't make a fundamental change, needs to come to our country. This is in my latest book, Discover Your Optimal Health. But bottom line, maybe we should be putting on, you can see they've been changed the colors kind of a little bit to disguise who this, what company this actually is, but they do have these golden arches. And you can see we need to start putting warnings on the food. You know, I was talking to a group earlier in the week, and I was flying back at night, and we flew over the interstate, and I realized that the McDonald's sign, there might have been Burger King, they're all yellow and red, so they stimulate your appetite, are like blood samplers. You know, if you think about it, really, right? Because, you know, you're driving down the interstate at night, or you're coming back from San Diego or somewhere, and, you know, the bright lights, it's dark out, and it's just like a bug. You know, bugs go like Taco Bell, right? And I don't mean picking on all the fast food companies, but yes, I do. Is that, you know, the bug sees the UV light, goes through it, zap, and he's dead. Well, actually, really, we're pulling people into these places. We're just killing them softly with our food.